What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right, in 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Adenta new site behind the CAF International School opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.
Hello, dear friends. I want to welcome you to the Zoe Health Talk Show. The Zoe Health Talk Show is a health education program which comes your way every time on this platform, on this station. My name is Dr. Fiao from the Zoe Fertility and Alternative Medical Center. Today, I want to talk about erectile dysfunction. Erectile dysfunction. Erectile dysfunction is the inability of a man to get or keep an erection firm enough for satisfactory sexual intercourse. And then also there are some men who have low interest in sex, low interest or loss of libido. Sometimes some men will say that they live with their partners, but they don't have any feeling, any urge to engage in sexual relations with their partners. Sometimes it may be that there is a problem. And so when you have a problem where there is loss of libido, or sometimes you are unable to get an erection firm enough for satisfactory sexual intercourse. There are those who get an erection, but sometimes they have early ejaculation, where within a short period, sometimes less than 1 minute, then they ejaculate, and then they are unable to get an erection again. And sometimes it will take some days before they are able to achieve another erection. And so when you have a problem like that, it is a case of erectile dysfunction. It is a case of erectile dysfunction. There are those who, when they get an erection and then they are ready to perform, suddenly then they lose the erection. The penis becomes weak and they are unable to have sexual intercourse. So when you have a problem like that and you are unable to keep the erection firm enough, it is a case of erectile dysfunction. There are various medical conditions that causes erectile dysfunction. There are various medical conditions that cause erectile dysfunction. One is that when you have problems with the hormones, your sexual hormones, the male hormones that regulates your erection and all that, when you have problems, when there is hormonal imbalance, that can be a problem of erectile dysfunction. And so there are men who have low levels of the hormone testosterone. And when that happens, it can lead to a case of you having problems with getting an erection or getting a firm erection. Secondly, when you have certain hormones like prolactin and it's very high in your blood, you have the blood prolactin level is very high, it can also affect your erection. And so prolactin is a hormone that is normally produced, and it's produced. It helps for women especially to in terms of the production of breast milk, the development of the breast and all that, men have some amount of prolactin, but it is in a very small amount. But there are instances where men can have excess production of prolactin levels in their system, and that can also affect them in terms of their ability to get an erection or keep an erection. And so hormonal imbalance is one cause of erectile dysfunction in men. Secondly, when you have conditions like diabetes mellitus or high blood pressure, hypertension, or you have heart disease, you see, for you to be able to get a firm erection for satisfactory sexual intercourse, your circulatory system, your nervous system, your hormones and all that must work properly. But when you have certain medical conditions that affect your circulatory system and all that, then eventually it will affect the way you are able to get an erection and keep an erection. So if you have a heart condition like heart failure or congestive heart failure, or you have hypertensive heart disease, which has affected the way your heart pumps blood, it is likely to affect your erection. And so you may end up having problems with getting an erection or keeping an erection firm enough for satisfactory sexual intercourse. Or you have a condition like diabetes mellitus, where your blood sugar level is not controlled and then it's excessively higher than normal. It affects your nerves and it affects other vital organs, including your erectile tissues, and that may end up in you getting problems with erection. When you also have problems with your prostate as a man, you are having prostate enlargement or prostate cancer. Sometimes the complication of having such a condition leads to erectile dysfunction. And so there are some men who have come with problems of erectile dysfunction, and sometimes when you do the checkup, one of the things you find out is that they have enlarged prostate. And you see, when a man has an enlarged prostate, there are various signs and features that will show. One is that there is frequency of urination, especially at night, where sometimes when you feel like urinating, if you don't hurry to get to the washroom, you may end up urinating on yourself. And then the other two, that sometimes they can end up getting urinary retention, because what happens is that the prostate gland enlarges and it can occlude or block the urine passageway, and sometimes that can lead to the urine getting retained in the bladder, and so there is difficulty passing urine sometimes with enlarged prostate, and that makes it difficult for the person to be able to have free urination, and that can lead also to a problem of erectile dysfunction. So that is something we have to take note of. There are those who get erectile dysfunction because they are on certain medications, and the side effects of the medication is that it leads to the erection becoming poor, or it affects the way they are able to get or keep an erection. And so the side effects of certain medication that you may be taking can also pose that problem to you. And so when you have erectile dysfunction, sometimes it can affect your emotional, makeup and all that. Sometimes there are those who have erectile dysfunction not because they have medical problems, but sometimes they have psychological problems. When maybe you have problems in your relationship and all that, and so there are the psychological aspect of it, which when you are seen by a doctor and then you have to be managed, we look at everything in total to find out what is actually causing your erectile dysfunction problem so that it can be managed accordingly. Our time is almost up, and so God willing will come your way again. But I want you to take note. If you have any health issue that you want to have a personal doctor to discuss the issues with, you want to do a general checkup to know the state of your health, you can always write the numbers down the screen, and then you can call, and it will be of much help to you. God willing will come your way again. Bye-bye.
What What is the state of your health? Do you have a case of male or female infertility? Have you been told you have a low sperm count? Do you have a prostate problem? Are you a lady suffering from abnormal menstrual problems? Never worry again. Zoe Fertility and Alternative Medical Center has all the answers to your health needs. At Zoe, we treat all kinds of health problems, including erectile dysfunction. Zoe Fertility Center has a state-of-the-art laboratory and an ultrasound scan services available. There's also the total body scan, which scans all your organs in 5 minutes. Yes, you heard right. In 5 minutes. Our pharmacy is well stocked with good and highly efficacious natural medicines, all without side effects. Locate Zoe Fertility and Alternative Medical Center at our Adenta new site behind the CAF International School opposite Mechanical Lloyd on the Adenta Ebri Road. At Odoko, we are near Nicolisi Hotel behind International Needs. Odoko Terrazzo. Call 0205 363614 or 0243 239534. Zoe Fertility and Alternative Medical Center, excellent healthcare, our hallmark.